Once again, welcome to Desol Health Series. This is going to be the very third edition in this month of April 2023. By the grace of God, this webinar series is being organized by Desol Medical Center. You might be wondering, where is Desol Medical Center? Desol Medical Center is located at number 12, Balogun Estate Road, opposite Farah Park by Majek Bus Stop, here in Shombo, Tedu, Lagos. We have been having several speakers. The last webinar we had a consultant from the General Hospital in Fakojai, in person of Dr. Bolade Lasisi here, talking about ischemic heart disease, and our in-house doctor talking about the use of the electrocardiogram machine, in person of Dr. Iris Chukwuemeke. By the grace of God, today is another wonderful session, and I want a I'm trusting God for a very exciting session this afternoon, because we'll be having a fantastic topic to talk about. We call it the importance of the full blood count test. I know many of you might be wondering, full blood count, you get to the medical center, or you get to any of your doctors, and you just see the doctor just write on the diagnosis sheet FBC, and you be wondering, what's FBC? Is it malaria test? Is it typhoid test? What is this FBC all about? So all these, our speaker is going to be talking to us about it today. Full blood count. She's going to be demystifying everything about that full blood count test. You know what it's all about and why is it so important. So once again, let me just re-emphasize that this is Desol Medical Center, and you can see that today we are set up right inside the heart of the lab. We are in the lab today. We came to the lab to run this test, so we know what they used to do inside this lab. Some of you always wonder, why is the lab always closed? Why is the lab a stronghold? So today we are in that stronghold. We set up in the stronghold today, and there will be many things. As you can see, we have several machines for you to look around here. So at the end of this session, she's going to be telling you about the full blood count test. So should you have any question, maybe you have one thing or the other that is bothering you, or you have any question you'd like our speaker to demystify, to talk about, you can send it to 081-8689-9594. I come again, 081-8689-9594. That's the number for you to send in your questions to, via WhatsApp or via text message, or you can call in into that number, and I assure you that you will get appropriate responses from us. So today, by the grace of God, our guest is no other person than med lab scientist Ifunanya Chukwu. Good morning good afternoon this afternoon. Good afternoon.
Good afternoon.
How are you doing today?
I'm doing very
You're looking gorgeous. You're looking wonderful. So today she's going to be talking to us about the full blood count test. So would you have any questions you'd like to ask? Let your questions begin to come in. And let me also just use this opportunity to inform you that the video recording of last week's session, that's about ischemic heart disease, ischemic heart problem, and atrial fibrillation, and the purpose of the ECG test. The video will be live on our YouTube channel. So if you've not subscribed to our YouTube channel is Desol Medical. So just search on YouTube. When you open YouTube, on the search bar, just search out for Desol Medical and hit subscribe button. So all our videos there, you see our previous videos are also there for you to see. Also, you can also reach out to us on our Twitter page. You will also see there Desol Medical. You will see it there, Desol Medical. You can see various chats or various questions you have. You can also forward it to us, and would respond to you on Twitter. On Instagram, we are on Instagram as Desol Medical Center. On Instagram, we are Desol Medical Center. You can also reach out to us there. And on Facebook, we are always very much available on our Facebook channel. Our Facebook page is there. You see us as Desol Health Group. Don't get it twisted. It is Desol Health Group on Facebook. It is Desol Health Group on Facebook. So you can send your questions there, and I assure you that in a very, very short time, our admins are going to respond to your enquiries. And also, you can also reach out to us via mail. Our 247 email address is info@desolhealthgroup.com. I come again, info@desolhealthgroup.com. Also, our website is www.desolhealthgroup.com. Here in Desol Medical Center, we have an in-house laboratory where all range of tests are done, starting from the microbiology test to the hematology test to basic immunology, chemical pathology. We also have a diagnostic center available. We have an ultrasound scan machine available here in this facility, and we also have various pathology tests that can be done. So all this, the engine behind our laboratory, she's the one that is here today, Med Lab Scientific Triple. So you can bombard her with any questions. I'm always here. I'm here to help you. If you don't know how to fight, just send your questions to me. I will help you box her with questions. So just get your questions available. Here in Desol Medical Center, we run various facilities. We have a general practitioner that is always available. We also have consultants that come in once in a while. One of them was the person that had the last webinar with us last week, in person of Dr. Bolade Lasisi. He was the one that handled issues relating to the heart. So you have any heart condition, you have any issues, just book an appointment with us on our website at www.desolhealthgroup, and we'll book an appointment with Dr. Bolade Lasisi at an opportune time for him. He will come in here and check you out at very considerable amount. In fact, our prices are one of the pocket-friendly prices in the whole of Etiosa local government. So you can just make out time, make out time out of your busy schedule and come in here, and you would have a full range of facility. And also, let me just chip this in. Our facility is not an hospital that we don't run 24/7. We only run an outpatient facility. But should we have patient that needs to be placed on bed rest, maybe after their point of care has been given, we have an in-house resting facility that you can rest while they are on observation for any treatment that might be given. So our doctors and nurses are fully on ground to handle everything. We also have antenatal services that are run here in this facility. Antenatal services will run all tests that are available to be run are run. The ultrasound scan to be done for the patient. The total number of ultrasound scans available in this package are 5. 5 ultrasound scans will be done. And do you care to know the amount that our antenatal package goes for? Very, very cheap. Although without delivery, our antenatal package goes for just 50,000 naira. Can you imagine? And all through the weeks running to the point of delivery, all medications that should be done and all tests that should be done will be done for such patients. And by the time of delivery, we have other hospitals that we are partnered with, like the likes of Care Max Hospital in Shangotedo here. So we have Greeks in Abidjan there that will refer patients to, depending upon the prices and the proximity of the facility referred to your house. So you can go there and take your delivery. All your records will be forwarded from Desol here to the facility you are referred to. So make sure you also come in here, do your family registration. Our family registration in this facility is just 7,000 naira, and it covers 4 of you. So you can just come in. Our registration in this facility is just 3,000 naira, and consultation is 2,000 naira, making it 5,000 naira that you're gonna pay. So you can see that our prices are relatively fair for you to run. So make out your time to register with our facility. We have other companies, hotels, schools that are in partnership with us, that we run care for, that we're in charge of their healthcare, they are all running. And we also have HMOs that are registered with us. We have HCI, we have Bastion, we have IGEA, we have Clearline, all registered with us, and a host of others. Very soon, Reliance will be joining us. Axam and SAT will also be joining us in very soon, very soon, because they've come to inspect our facility. We hope that very soon all these other big HMOs will also be registered with us. So I hope to see you. You will also see me. You will always see me in the facility here. So back to our beautiful med lab scientists. So today we'll be talking about the full blood count test. So I want to hand over to the beautiful and pretty med lab scientists. Don't come ask me for no number actually. So over to you, MLS. If I should please tell us about full blood count and its importance. Thank you very much.
Okay, thank you, Mr. Sanjay.
Thank you.
Our topic today is importance of full blood count. So before we delve into the importance, we have to know what this full blood count is all about. I have a patient that came in the other time and be like, I did full blood count last month now. I did full blood count the other time. So why must I do it again? This is it. Full blood count, from the name full. Full blood count is same as complete blood count. It's a blood test that counts the different cells in the blood. We have blood. Blood is divided into three. We have the plasma, we have the blood cells, and we have the buffer code. So in the cells, we have the red blood cells, we have the white blood cells, we have the platelets. The platelets are embedded in the buffer code. Why we now have the plasma? The plasma are the ones that contains the chemical components of the blood, those ones that has the hormones and everything. That's what we're talking about. Talking about the cells, full blood count cells. So full blood count is a test that measures all the red blood cell, all the cell components, all the blood cell components. That's full blood count. It measures all the cell components. And what are these things? Like, and it contains, it has up to 8 parameters that it checks for. It checks for red blood cell, it checks for hemoglobin, it checks for WBC, that's white blood cell count, neutrophil, lymphocytes, eosinophil, basophil, monocytes. All these things I mentioned, they are the things that make up this full blood count test. So it's a variety of tests in one. So that's what it is. Then coming to this red blood cell, because remember I've already grouped it. This full blood count, we have the white blood cell count, we have the red blood cell count, and then we have the platelets. The red blood cell counts are the ones that deals mainly on anemia. You know, it checks anemia. I'm just giving you the introduction. It checks on anemia. Then the white blood cell deals with infection, anything infection, some cancers and all the immune system. While the platelets deals with clotting, clotology, blood clotting and all that. So coming to the red blood cell, we have under this red blood cell, we have red blood cell count, we have hemoglobin estimation, we have PCV, or you can call it HCT. I'll make use of HCT, or I can still interchange it, but HCT is measured because we use automation. These are local machines, so make use of automation. So we refer it as HCT, but it's still the same. PCV is when you're using centrifuge, hematocrit centrifuge. It's called Paxel. And then we also have the red cell indices. Talking about the PCV. PCV checks the blood, it measures the blood, the red blood cell in percentage. It measures the red blood cell in percentage. Like all these things that are kind of similar and interwoven together, because this red blood cell counts. It counts the red blood cell. Then PCV now measures it in percentage. And then this PCV now, it measures when it's high, it can indicate that the person has polycythemia. That polycythemia, that's when the red blood cell is very high. Then when it's low, it can mean that the patient is anemic. But PCV alone cannot indicate that the patient is anemic, because it goes hand in hand with hemoglobin, which is Hb. Hemoglobin is found inside the red cell, because this hemoglobin is the oxygen carrying molecule in the red cell. Hemoglobin, when I say hemoglobin was hand in hand with this HCT PCV, is that PCV, what it calculates is the matured red blood cell, because red blood cells normally starting from how it's being produced from the bone marrow, it enters the cells and everything. So it's the matured red blood cell that carries the hemoglobin, which is the oxygen carrying protein. So inside the red blood cell, that's where you see the hemoglobin. So, but this full blood count now measures them differently. Hemoglobin, when you can now say that a patient is anemic, is when the hemoglobin is also low, and then the PCV is low too. Then the red cell indices are the MCV, the MCH, MCAC, mean cell volume, mean cell hemoglobin, mean cell hemoglobin concentration. All these things are just the kind of it kind of differentiates different types of anemia, because MCV has to do with the shape of the blood cell, the other one has to do with the sizes and all that. Then coming to the WBC, which is the white blood cell count. White blood cell count, it's the soldier in the body. Do you get it? It's just like the soldier, like they fight. It's the one that fights infection. And then with this soldier, with this WBC count, once it's low, that's leukocytopenia, it can indicate that a patient has typhoid. It can also indicate for TB. Do you get? But this infection, now this WBC count infection, how you will now know the one that how you will now know the particular infection it fights. Well, that's where it will now lead us to the differentials. These other ones I mentioned, the neutrophils, the lymphocytes, the eosinophil, the monocytes, the basophil. These tests now are part of that are under the white blood cell count. Just that the neutrophil, once neutrophil is high, you can now start checking for, okay, is bacterial infection, you get, because that WBC is generally for infection. Then it's the differential that can now tell you, okay, this is a particular one. Neutrophil can tell that this is bacterial infection. Lymphocytes is usually viral infection. Then, and sometimes it could also mean typhoid. It could also indicate that there is a typhoid infection. So it's not only viral per se. And then the eosinophil. The eosinophil, it's majorly for parasites, like all these bookworm, especially in children. Once children, if you run tests for children, then the eosinophil is very high. Just know that it could be all these Ascaris lumbricoids, all these parasitic ones. And then this eosinophil also has to do with allergic reaction. Some allergy, if it's high, it signifies allergy. And what do I mean by all this thing? Because some of these white blood cell counts, they don't stay in the blood, they don't circulate in the blood that long. For instance, neutrophil just circulates in the blood 6 to 8 hours after its production, after it's released in the bloodstream. Then after it's released in the bloodstream, within those hours, it will now enter the tissues, where it will now stay and protect. Just like I mentioned initially with soldier, I used the example as soldier. Just like in this country now, if war breaks out, definitely the soldiers will go and fight the war. But if war, like if there is no war, they will be in the country protecting the citizens and all that. So that's the function of this white blood cell count. If there is a war, or let's say there's an infection, that's when you will see them. They will not enter the bloodstream and all that, trying to find the trigger, what actually wrong with it. But on a normal, it should not be found in the bloodstream. Then talking about the platelets. Platelets just has to do with clotting, clotology. Once the platelets is low, it means that the blood somewhat like it means that there is a serious health issue, complication. Maybe it could be as a result of anything anyway. But the patient's blood will not be able to clot, because there are some cases that you collect simple blood sample, just to collect blood sample from a patient. Before the blood stops flowing, like it's quite, though it doesn't happen to many people, there are some people that it's just few people that experience this. And then coming to pregnant women in antenatal cases, if platelets are low, maybe let's say less than 100, most times they transfuse them, the platelets itself from the blood, because if not, this kind of cases that normally result to postpartum hemorrhage. Woman will start bleeding and all that. And then if it's low, they also have some drugs they give to the patient to be able to, yes, to boost it. So that's just all about the full blood count.
Wow, that was a great one. Well, before I begin to ask questions, can we just do a simple full blood count test? Can we just do a simple full blood count test? I want to see how this hematology analyzer works. I want to see how it works. Yeah. Can we just take it? Yeah. Let's take a sample. I think I'll be the lab rat today. Let us see the process in the lab. Let's see the process in the lab on this hematology analyzer. Let us just see how it goes. Let's see how it goes. Let's just see that before we now continue our talk on this full blood counts. Full blood count and PCV. I think there's always a disparity between PCV and PCV and full blood count. Wow. I'm going to shoot you. So you are seeing. Oh my God. Oh my God. You want to shoot me? Can you imagine? Hey, don't shoot me needle. Wow. I know you are all familiar with this process. Whenever you come to the lab, you used to do something like this for you. So let's see. Alright. Mamas at duty. Mama at duty. Because I just want us to see the process of how it's done. What makes it so automated, as it's always announced. But what machine is this?
Electrophoretic machine.
It's for genotype. Wow. So this is what they used to do genotype. You can see it. That's light on it. We're in the lab today, so you can come to all these tests are run here in Desol medical facility. You can see that you can come and run your genotype. You can see all that big machines here. See, I think this is the incubator, right?
Yes.
Mm-hmm. Yeah. All right. Let's see. Now I'm the lab rat here. Oh, sorry. Wow. That's just all.
Yes,
To pick it. You can see many laboratories do not have this. Many laboratories do not have this automated, what do they call it now? Oh, let me read what's on the machine. Fully auto hematology analyzer. Many labs do not have this. So I want to ask, we used to see many doctors just request for PCV. And whenever we come here, what we are saying is FBC. Why? Or what's so specific about the PCV?
PCV, I think it depends on what they are looking for.
Alright.
The PCV, just like I said, it measures the red blood cells percentage. It measures the red blood cell percentage.
What if I think there was a case that was brought to the facility some weeks or some months back, like, if my memory started correct. I said the PCV of the woman was very, very low. What will this food block count be able to get that? And they said the PCV of the woman is very low, and they were like, maybe we're going to transfuse blood or something like that to the person. What would warrant that?
What could warrant the PCV to be low?
No, yes.
It depends. There are some diseases. There are some even malaria, serious malaria can make PCV to be very low because it comes with fever. And when there is fever, there is depletion of red blood cells. It will start dying off and all that. So, and
I think it has finished. Wow. So you can continue, there's nothing more to say.
So that's it. It has different, and then sometimes it will be bleeding. There are some people that yes, but that's why I mentioned initially that hemoglobin and